Hey everybody, welcome back. It's Dr. Osborne, and we are live for another episode of Pick Dr. Osborne's Brain. I'm really excited tonight because I've got a special guest on with me. We had Dr. Jones scheduled. We got Dr. Jones's partner, who's just as knowledgeable and just as thorough on the topic tonight. So I'm really excited to have Dr. Ryan Wolfert here with us. Thanks for joining us tonight.
Man, hey, I'm glad I could hop in and provide some value for all your listeners and watchers out there.
Yeah, so I'm really excited about the topic. We've got, tonight we're going to be talking about brain function and really with a twist on physical exercise. But before we get started, those of you just tuning in, you know the rules. I want to know who you are and where you're from. So say hello to us and let us know where you're chiming in from so that we can get an idea for you. And if you've got questions, just like always, we're going to take those first come, first serve. So if you've got questions you want to get answered tonight, make sure keep them on topic. We're talking about brain health tonight. We're talking about preserving brain function. So keep them on topic and we will get as many of those answered as we can. And as we see people rolling in already, we've got Joanne from Louisiana and Wanda back from Tennessee, Lisa from Massachusetts, Christina from Ohio, Anastasia from Arkansas, Patty, where are you from? Chime in, let me know where you're from. We got Gabriella from Peru. I think last week we had more people from Canada pretty much than anywhere else. So where are my Canadians tonight? Let me know that you're here and that you're tuning in. Oh, there we go. Tammy from Ontario, Canada. We got Patty's from Fort Worth. Tammy from Susan from Washington State. Lynn from Australia. We've got Soon Thomas from Alice, Texas. So just keep chiming in. We got Lynn from Australia. It looks like the Australians are going to win tonight. Okay, so let's dive right in. Again, this is tonight. It's Pick Dr. Osborne's Brain, but really, it's not that at all. It's Pick Dr. Wolfert's Brain. So we're going to start off the conversation, and they've got a really, really unique summit coming up December 3rd through the 9th. If you haven't registered, I'm going to give you some information tonight on how you can get registered for that. It's a free Superhuman Brain Masterclass. It's full of great interviews like you would see in a typical summit, but also full of other classes, like specialized classes to help you optimize your brain function and preserve it. And tonight I wanted to talk a little bit with Dr. Wolfert about preserving the brain through physical activity. And so I'd like to just kind of throw this question out to you. Why is exercise important for brain function? Can you talk a little bit about the connection between the brain and physical activity?
Well, just at a basic level. Is that okay? Am I echoing or okay? Cool.
No, we can hear you fine.
All right. At a basic level, just movement in general is going to increase oxygenation, get blood flowing to your brain. So the more oxygen you get to your brain, the better it's going to function, and the more you're going to upgrade it, take it to the next level. So just at a basic level, that's part of the body's, the body is designed to move, and that movement will increase blood flow to the brain. So right there, but we can get into the science of it. We can get into all sorts of reasons why physical activity is great for the brain. We can even talk about how, I'll even put this in there, maybe not movement as much as, or just as important as your posture, your static posture. Now, that's one thing that we touch on in the masterclass too, but we don't give a whole lot of background in that. So this is good that I'll talk about it here, because posture, if your spine, if your posture is all screwed up from us on our smartphones, on the computer. So if you're watching this, you want to make sure you have good posture. That right there, if your spine is distorted, if your posture is bad, you get the forward rolled shoulders, head forward, mechanically and neurologically, that's going to affect your brain. Just mechanically, it's not in a low stress position, so you're going to waste too much energy. It's going to decrease your energy. Your body's going to have to react in certain ways to help you just get throughout the day rather than thriving. So that's an important part. It's kind of weird to say, but not moving is really important as getting movement in as well, because this also leads into, if your static posture is bad, then the movements that you create aren't going to have the effect on your body or your brain to have the benefit that you want, whether it's to live a healthy life, whether it's to lose weight, whether it's to build muscle. All those are going to have an effect on how your body does that. So both static and dynamic, quote unquote, movement is important for brain health. And if we want to get into the science of it, for example, one thing that we touch on a lot is BDNF, brain-derived neurotrophic factor. And this is something that I learned in my research for the Masterclass over the last year or so, is how important that is, how many experts bring that up. And what brain-derived neurotrophic factor means is when you exercise, especially strength training or like HIIT training, high intensity interval training, where it's those quick bursts followed by periods of rest, that increases your BDNF, which means you're going to increase the connections between the neurons and the nerves. You're going to create new neurons called neurogenesis. It's going to help neuroplasticity and help those new nerve cells to create new nerve cells, and then also learn how to use them in a healthy way. So that's one of my favorite quote unquote facts that I've learned over the last year.
So let's go back a minute. I want to pick your brain a little bit on that static posture thing. So, I mean, so many people go to work, they're sitting for 8 hours a day, minimal break times. There's, their head forward posture, looking at a computer screen. They forget to take deep breaths. They're not getting any oxygen. I've read some studies that show that bad posture can reduce oxygen intake by as much as 20–30%. Can you talk a little bit about posture, what people can do? Like, what are some of the takeaways of that? If we're talking about what does bad posture look like, and what are some of the takeaways that people can do, and what are those going to be beneficial for them?
Well, I mean, a simple test that I use with my patients and clients, and when I do talks everywhere, because it has such a big effect, is like and everybody can do this right now, is just slump down. You slump down, head goes forward, and then take a deep breath. And then sit up tall and take a deep breath. What's easier? And hopefully you can see that, or you can even feel it, is sitting up, you can breathe a lot easier. So obviously you're going to be getting more oxygen into your lungs, into your body, into your brain. And if it's not easier, here's one of the problems. If you're saying it feels the same, that means your body might be so dysfunctional, your posture might be so bad where you can't even get to that. So what you can do to start off, I mean, is one, I'll share this one tip with you. So many people have smartphones, I would say, a majority of the people watching. And what I notice, again, I'm very attuned to it because it drives me nuts when I see it, but they don't know any better, is they look at their phone. I don't know if you can see me, but their phone is in their lap. They're all slumped down like that. And just a simple fix is just bend your elbows a little bit, and you could bring it up halfway. I'm not saying, you have to hold it like that, but just, at chest level, and you're going to decrease the effects probably by 10, 20 pounds of the stress that you're placing on your neck, and if that's out of place, it's going to affect the nerve signals, the circulation going up to your brain as well. It's going to affect your energy levels because, again, if I'm out here like this, I don't know if you see me, out here, for every inch that your head or your ear is forward from your shoulders, adds 10 pounds of stress and pressure to your upper back and neck. Just like if you're holding a 15-pound dumbbell out like this, your body is working harder to hold that up. And this all relates to each other, where that now you're wasting energy just getting throughout your day because of the physical posture and the physical stature that you're in, that you don't, by the time you get home, you won't feel like exercising. You won't feel like even, creating or making healthy food, because it might just be easier to stop at Taco Bell or stop at McDonald's or stop at, a fast food restaurant and picking that up. So and that's one of the things that I love talking about is energy, how to boost your energy, boost your brain energy, your body energy. Because I run a site called upgradedparents.com, and that's who I talk a lot with and talk a lot about. Is I'm a parent, I have 3 girls. I want to make sure my health, my brain health, my body health is at the highest level. So I'm around to take care of them for my entire life. And so then, so I'm not a quote unquote burden to them, because I've seen too much of that as well. So one tip, hold your phone up. Very simple. That's a minimum. There's a bunch of exercises that you can do. I share some in the masterclass, but one of my favorites is like a good sitting break is just putting your hands behind your head and neck, pulling your elbows back, chest up, pushing your head back into your hands, and just holding that for 5 to 10 seconds, then you can relax. 5 to 10 seconds and you relax. Okay, and doing reps and doing that for a minute every half hour, every 45 minutes. Because I talk to people and patients that they get up twice in an 8-hour day. Holy cow, it's no wonder that they're feeling the way they do. Their energy zapped. They get headaches, they get anxiety, because these things are like drops of stress in a bucket, where every drop that you get in the bucket adds up, and then you don't feel any symptoms until that bucket overflows with stress that you placed on your body. So I love this. I do this one regularly throughout my day, and every morning I do this, incorporate this into my mobility routine.
Love it. Simple stuff, right? Just really simple. So guys listening to this, if you're a desk jockey, right, and you're at the desk all day long, simple thing you can do: lift your head, tilt your monitor so your head can come up a little bit higher, take your arms behind your head, do a little bit of posterior chain activity or mid-back exercise just periodically. Talk a little bit too. I want our audience to understand the connection between motion and movement and cerebrospinal fluid circulation around the brain. Like very, very few, you hear about all these people developing inflammation disorders of the brain, cognitive decline, Alzheimer's disease, dementia, but you also hear about people who just get the brain fog. They can't think clearly, they can't recall words, and they're sitting and they're sitting and they're sitting and they're sitting, and nobody realizes that the cerebrospinal fluid motion and movement is so important. Can you talk about the importance of that along with the importance of motion?
Well, that's most of the nutrition and the cerebrospinal fluid delivering all the fluid around the brain comes from motion. With me, it sounds weird, but I don't get like really inundated in all the research. I like common sense type things that make sense. If your body is not in motion, how is anything going to stay in motion? It just doesn't make a whole lot of sense to me. But the cerebrospinal fluid, it without that, how is your brain going to get the nutrition that it needs? And when that cerebrospinal fluid is flowing, when the oxygen's going to your brain, all that, your memory's going to improve, your thinking's going to improve. And if we focus on those things rather than rather than like treating disease or getting complicated with all these sophisticated tests, if we do the essentials, sleep, nutrition, fitness, exercise, movement, posture, then it's like a side effect. Your body and brain just gets healthier. The cerebrospinal fluid is able to flow. The lymphatic system's flowing. You're filtering out the bad and adding the good into your body and the brain.
Yeah, love it. Love it. We've got more of you chiming in. We've got Maria from El Paso, Marie from California. Again, if you're just coming into the show, welcome tonight. We've got a special guest, Dr. Wolfert's, talking about preserving brain function through physical activity and through movement, motion, and posture. And we want to take those questions. Those of you that have them, make sure you're pumping those questions into the feed. I'm going to get to them here shortly. And we will start answering them. But one just came up, and I think we'll go ahead and take it. Michelle Hart wants to know, can this help an acquired brain injury? And maybe we need clarification from Michelle, but I'm going to let you take that question anyway.
I'm assuming that means like a concussion, or which I can address that. Yeah, I'm not the expert in concussion repair. That's why we have experts coming into the Masterclass. So there's Dr. Dan Engel, and then also Dr. Titus Chu. Dr. Titus, I interviewed, and he's got a 6-week brain save program because of Dan Engel and also Titus Chu, their experience with concussions, brain repair themselves. But yes, this definitely applies to that, because in those 6 weeks, for example, in Titus Chu's, he talks about movement and fitness as a way to, it's one of the aspects along with nutrition and sleep. And creating like a positive mindset, like subconscious reprogramming type activities into the program. So yes, fitness, it's one of those where if you want a healthy body, healthy brain, that's one of the core pillars that you need to incorporate. It's just, that's just the way it is. So yes, it definitely, if that's what you mean, like an acquired injury to the brain, yes, it definitely helps with that.
So she's chiming in and says she has short-term and long-term memory loss as a result. So I don't know that really clarifies or differentiates enough for you.
Well, I think in the past, again, I don't know how many years ago, the years kind of fly by, right? That they used to think that whatever the brain was, whatever brain cells you had, that's what you had. You couldn't heal the brain. But with what we know now, if you incorporate fitness and food and things that nourish the body and brain, it can heal. It's not going to happen overnight. Even if you got a brain injury overnight where it affects your short-term and long-term memory, you can get an injury overnight, but it's not going to heal. Just like if you cut your hand, cut your leg, especially if you need stitches, it doesn't heal overnight, might leave some scar tissue. So it takes time and energy and effort for that to repair itself.
Yeah, and now she's chiming in and it was saying that it was from a car accident. And I would just simply add that, traumatic injury to the brain can definitely heal. It does take time. It's one of the slower tissues in the body to heal. And I'd say where I see people not really healing very well, at least in my experience, is when they don't have their nutrition dialed in. If you're iron deficient, if you're B12 deficient, you're not getting enough oxygen carriage, your red blood cells are not being properly formed to carry enough oxygen, then the healing process is dramatically slower. So, make sure that you're following up with whoever's taking care of your memory loss issue and following up and getting the right types of appropriate nutritional laboratory evaluation done so that you can maximize your ability nutritionally to carry that oxygen to your brain to get it to be able to heal quicker.
That's a great point, because I'm glad you brought that up, because we have to find out what's causing it, right? And that's through the lab tests, through other tests to find out, rather than just throwing. I mean, I believe exercise and fitness, just going out for a walk, it's not going to hurt. But when we're talking about food, what foods are going to be the best for you? What nutrients could you be deficient in? What toxicities might you have that would prevent and interfere with using the nutrition that you're putting into your body?
Yeah, absolutely. Barbie wants to know, she's in Garland, Texas. She says she's tethered to her computer during the workday, and she has short and long-term memory challenges, but no injury. This is her phraseology. It's the computer, isn't it? Care to comment on that for Barbie?
Well, again, I'm sure that it plays a role in it, especially if you're tethered to your computer. I'm not sure how much you are able to get up throughout the day doing that exercise. If you saw that, making sure at the other times of the day where you aren't tethered to your computer, because here's the deal, and this is a situation that so many people are in, is, I don't think you're going to quit your job tomorrow after you listen to this, right? So we have to do things that counteract the bad stuff that we do to our bodies every day. So if we keep doing those, so if you are tethered to your computer and then you go home and sit on the couch and watch TV for another 3 hours, well, now you're just compounding the effects of that. At lunchtime, are you able to get up, move around for 15, 20 minutes at a minimum? Possibly even, making, your lunch to go so you can go for a walk. Because you said she's in Texas, right?
Yep.
So you're in Texas. So you probably have good weather most of the year. I'm in Lansing, Michigan. We just got a nice 6 inches of snow last night, all before December. And like for me, because I've incorporated as a habit, I shovel the snow. I don't have a snowblower. I shovel my driveway, and I see it as it's exercise for me. That's how I put it. And when I put it in those terms, I'm like, I don't mind doing it as much because I incorporate it into my daily activity level. So that's what I would suggest to you is, okay, you're at your computer most of the day. Make sure when you get out of work, you're walking. Park far away. Instead of parking in the closest spot at work, park as far as you can. Park across the street. Same thing when you go shopping. Park far. Wherever you go, incorporate exercise and fitness into your day. And that's one of the tips I love to give is is you don't have to set aside an hour each day to exercise. You might be able to do like 6 10-minute bursts or 6 10-minute walks. Let's lower that a little bit so it's not so daunting. But say you're trying to get 30 minutes of activity or exercise, break it up into 3 10-minute sessions or 6 5-minute sessions where you're getting up for a walk, or you can get one of those little bike foot pedal things you can put underneath your desk if you can do that. But that's what I had to say is counteract, the quote unquote bad stuff, unhealthy activities that we're doing to the body by counteracting that when you can.
Yeah, I love that. I mean, you've got to do what you can do when you can do it. And I think for most people, it's, look, I go to work and I sit 8 hours a day and then I exercise for 20 minutes. No, you've got to interject more kind of activity in the course of your day. You've got to plan for breaks. You've got to plan for motion and movement. What's your opinion? Because I know the question's probably going to come. What's your opinion on rebounders, whole body vibration? Do you like those types of things? Do you love those types of things? What would you recommend the average person have? You mentioned, pedals, and you mentioned a few other tips, but what do you recommend for those? Do you find those are like movement on steroids?
I love it. I love those. Actually, sitting right over here by my computer is my rebounder. So I incorporate that usually in the morning. I'll do that. I switch it up week to week. So 1 week every morning, I'll do that for my kind of lymphatic drainage type thing. Rebounding. Another week I'll do burpees. Another week I'll do like total body extensions. Another week, again, I like to mix it up before I do my mobility routine every morning. Whole body vibration. I love it. We have 3 power plates in our office. 3 power plates in each of our offices, and those are whole body vibration plates. And I love power plates because they I'm not saying you guys go out and get one. If you want to, go for it, but they're top of the line where they vibrate in all 3 planes of movement rather than just front to back and side to side. It's those 2 plus up and down and diagonal. So all different planes of movement. And what that does is that helps with the cerebrospinal fluid movement. That helps with lymphatic drainage. That helps with actually fat loss too. And losing fat, increasing the metabolism, increasing your energy, flexibility. That's the thing I've noticed the most using those is my flexibility has gone through the roof when I use the power plate. So yes, whole body vibration. Bare minimum for people, bare minimum is your body, but bands are a nice, easy way to do it. I'm a big Tom Brady fan, so I got his book TB12, and he uses tons of bands. He's 41 years old now, I think, and just still killing it, still healthy. That's the big part. It's not just about being fit, but he's also healthy, and that's what my goal is too. There's a lot of fit people out there that can run marathons and Ironmans, but that doesn't necessarily mean they're healthy and that their body is functioning at the highest level, because you've seen those people 45, 50 years old drop dead of a heart attack. So obviously something wasn't health-wise working to its optimal. I'm trying to think, what would you say? What would be the bare minimum? What do you like? Stability balls, they're nice. Some dumbbells, some kettlebells, those are nice, but you don't need a whole lot of equipment.
No, not really. I love a pull-up bar. I like body weight. Yeah. I like resistant bands. I like dumbbells. I love kettlebells, kettlebell swinging, American style, kettlebell get-ups, sandbags. I love a jump rope. Jump rope is, the child's toy, right? And that even hula hoops, if you like to just move and shake, that all those things are good. I'd say my opinion on the matter is do what you love to do that keeps you active versus, gruel through some kind of tortuous workout that isn't going to keep you consistent in the long haul. So I try to encourage people to exercise in the ways that they love to exercise. And if it's not enough, if we're not seeing that move the needle well enough, then we can start having some more meaningful, deeper conversations about using some of the technology like whole body vibration and other things to really accelerate their capacity. But body weight's my favorite style because so many people get in the gym and they do these limited 2-dimensional machines that really create more imbalances and dysfunction and disruption than anything else, at least in my experience. So interval.
I used to love going to the gym, and now I don't. Just one, because it can be overwhelming, and especially if somebody's just starting off, because then they head for the machines because they're quote unquote easier to use. But yes, I love that tip. find what you love to do. That's huge. So many people just go out and run because they think that's the only way they know how, or it's the best way to get in shape. And I even ask them that when somebody says they run. I'm like, do you love doing it? And if they're like, no, I hate it, I'm like, all right, let's find something else. But if they say they love doing it, it clears their mind, it's their stress reliever, I'm like, all right, cool, go for it.
Yeah, I mean, I think the biggest thing that people lack is the ability to control their own body weight. And so if we start with those fundamentals first, and many people, it's coordination. Coordination has to come before you try to give them some kind of a dynamic, advanced movement. Like an overhead squat with a PVC pipe is more of an advanced movement than, let's just say, hopping from one foot to the other without falling over. And some people are at different levels. So isolating and identifying where they're at first and foremost, and then secondarily meeting them at that level with challenging and dynamic exercises that enhance balance, but also strength simultaneously.
Yes.
But so we've got more coming in. Let's see here. I like this question. So let's go back here. I love to walk, have a border collie who loves it. My question is, I have a high resting heartbeat, a very high resting heart rate. To walk at the dog pace, my heart rate goes even higher. How high is too high? What do you think there?
I mean, are you out of breath? That's the big, you can go on that too. I mean, it's a border collie, she said?
Yeah. High energy dog.
Oh, high energy dog. Okay.
Probably a pretty good trucking along. Maybe I'd guesstimate 5 miles an hour which would be a pretty fast walk.
Yeah. I mean, I got a boxer, and I love walking her, and sometimes she likes to. Really, it's more of like dog obedience, to tell you the truth. It's, I'm like, Daisy, her name's Daisy, and I'm like pulling like heel, and I just have to keep doing that if I'm not up for going at a fast pace. But I'll run with her, I'll which she likes to do. But that it's more of just, I don't want to say controlling your dog, but that if you are limited by that, if that scares you to go at that too fast of a pace, but you want to just check your breath, if you feel like you can't breathe, then that is too high. If you are a little bit out of breath, and to where if somebody was walking the dog with you, or you're even talking to your dog, I talk to my dog, and you can say a few words and you're a little bit out of breath, but not bad. I'm assuming that'd be fine, because that's a measure of how fast your heart rate is going.
Yeah, and I would say too, if it's just a high pulse or a high heart rate, if you don't have high blood pressure and it's not giving you a headache, if your dog is really fast and you're really trucking, high heart rate at intervals is a great healthy way to improve your overall. You mentioned earlier a couple different hormones. Mm-hmm. It's a good way to get some of your hormones pumped out that are going to help maximize fat burning, maximize blood flow, oxygenation to your tissues. So kind of have to judge it. I think really if you feel like it's pushing yourself too hard, you got to use your own common sense and internal judgment. But I think that's probably the greatest answer you could get without, more detailed information, Tammy. But thanks for asking that question. Let's see here. Oh, I like this one. Cheryl says, can scoliosis or kyphosis cause brain fog? So we were talking about posture earlier. Can you mention or talk a little bit about that?
Yes. Just want to, definitely. Yeah. Scoliosis has been shown to, just self-esteem, even just like mental aspects of it, but it definitely affects your overall health. Kyphosis, same thing if you're like this. And the thing is brain fog, for example. Symptoms, the type of symptoms you have, it almost doesn't matter as much as that you have symptoms, because you could have scoliosis and kyphosis and get brain fog. Somebody else could have that and maybe get reflux, or maybe get poor memory, or short-term memory loss, or asthma. It just depends on what your weak link is. And we cover this quite a bit in our Masterclass, is what is your weak link? Because if it's like genetically predisposes you to that and activates and expresses certain genes based on your kyphosis, your scoliosis, the nutrition that you put in your body, the exercise that you do or don't get, the sleep that you do or don't get, that's what's going to exhibit itself as the symptom. So if your weak link is, to where it causes brain fog, that's what you're going to get. If it's something that causes pain or back pain or shoulder pain or any type of pain, fibromyalgia, then that's what's going to happen. If it's predisposes you to Alzheimer's or dementia, Parkinson's, MS, those are the symptoms that you can get. So that's a long answer to, can it cause that? It absolutely can. And just I'll even go a step farther. When there's alterations in the normal alignment of the spine, and there are normals, just like there's a normal blood pressure, there's a normal and ideal, blood test markers for almost every nutrient that we take, or every test that you can imagine. There's a normal and ideal for the spine. So if you look at the spine from the side, you want curves in it. It's a lordosis in the neck, kyphosis in the mid-back, and a lordosis in the low back, and they all equal each other out at about 40 degrees. That's where the minimal amount of stress is on your spine, on your body, on the nerves, and on the spinal cord. Now, when it gets too far away from that normal and ideal, that's what creates stress on your body, and you might not feel it right away, but can create symptoms like brain fog. From front to back, and that's where we talk about scoliosis, we want the spine straight. So if it's going to the side over 15, over 20 degrees, that's where you get the diagnosis of scoliosis. Same thing, that distorts the spinal cord, distorts the nerves, distorts the cerebrospinal fluid flow. So yes, absolutely, that's how it can cause symptoms like brain fog, as well as a lot of other symptoms.
Love it, because so many people don't realize. I think chiropractors really get a bad name in the mainstream medical community. They oftentimes are dismissed when, in fact, especially with scoliosis, probably one of the best forms of treatment that you could have, hands down. Even the research shows that, is find yourself a really good, solid, reputable chiropractor, have your spine analyzed, and if it's creating or contributing through, abnormal curvature, you should really, really think about going through some type of protocol treatment. But any chiropractic treatment protocol should include an evaluation first, and secondarily should include manipulative therapies, but also not just passive therapy. Chiropractic is a passive therapy, and you've got to couple that with active therapies like stretching and exercises, strengthening, and proper postural exercises. Otherwise, the adjustment itself is just like an aspirin, in the sense that's not maybe not, that's not the right analogy, because aspirin hurts you. Yeah. Adjustment does not hurt you, but it does become a passive, basically ameliorating type of therapy where you're getting some relief temporarily. But if you don't do the active work along with that, or if you go back to a severely sedentary lifestyle, then you're using chiropractic as a passive tool, and that's not what it was designed. Ask any chiropractor and they'll tell you the adjustment's going to help you. It's going to realign your spine. But if you're not doing your part, if you're not doing your stretches, your exercises, we're going to adjust you for the rest of your life forever. And you're still going to keep coming back forever, right? And the goal is to get you to a point where you're, where you're doing really, really well, and you don't need to have an adjustment every day of the week, right? Like that's something you should go on for maintenance after you're doing your part. So
absolutely,
scoliosis and kyphosis for sure, very, very beneficial. If you have a good chiropractor, go check that out.
Let me add this too, with scoliosis, with kyphosis, with any postural or spinal distortion. Now, if that's a weak position, because that's essentially what it is, it's an unstable position. Now, if you start exercising and loading it up with, if you're doing back squats or any type of like weighted movement, it's going to make it worse, because now you're adding extra weight to it. And even if you start running, that adds the extra pounding and could make that worse.
Yeah, going back to what you said earlier about posture, right? And making sure that posture is lining up to minimize the stress. Love it. Susan wants to know, if you have osteoporosis, is chiropractic care okay?
Yep.
Yeah.
Yes. Here's the thing is, that's why you want to find one that does a full evaluation and honestly takes x-rays. There's so many people that are so scared of x-rays out there that they're going to harm them, but the benefits far outweigh the risk. So that's the best way, or I should say the best way. One way that chiropractors can, or any doctor can tell if there is osteoporosis. If it's already showing up on an x-ray, then you already know you have over 50%, I think it's like 50 to 60% bone loss. And there's other methods, with chiropractic, they're, pop and cracks. There's so many other ways to affect the spine rather than just that manual manipulation. And, we have all those different methods in our office.
Fantastic. So let's talk. I know you've got just a couple minutes left.
Yeah.
Let's kind of talk to the audience a little bit toward the Superhuman Brain Masterclass that you're hosting with Dr. Isaac Jones together. I know the two of you have put together this really wonderful summit/masterclass. Tell the audience a little bit about how they can get involved in that.
Well, that's great, because it starts next week, week from today, December 3rd. So Dr. Jones and we put together 10 core masterclass sessions where we go over different aspects of brain health, how to heal your brain, how to upgrade its function, and how to take it to the next level with your sleep, with fitness. That's obviously included in there. Your nutrition, we touch a lot on toxicities, how to get rid of them, autoimmunity, which Dr. Osborne was so gracious to lend his expertise with that. Gut health, we didn't even touch on that. Well, this is more about fitness, but yes, gut health is so important with brain health. When you have a leaky gut, more than likely you have a leaky brain as well. It's that same type of phenomenon where things get through the gut, just like they do through the blood-brain barrier, that can cause inflammation. Same thing as with a leaky gut. So yes, we heal, we upgrade, we take your brain to the next level. For that 7 days, we release 4 to 6 different talks, 1 or 2 masterclass sessions, along with supporting expert sessions like Dr. Osborne's, so we can help show you how to take you from either whether you need to heal, or just maybe you're starting at a higher level where you don't really have any brain symptoms and you just want to think clear. You want to have more focus, have more clarity. Well, now we're going to start with the upgrade and take it to the next level where, starting to incorporate essential oils or fasting or intermittent fasting, ketogenic diet, using lasers to help your brain function and health. So we touch a lot on those types of things that are all going to help your brain function at the highest level, which I'm sure Dr. Osborne will share a link with you where you can click on that, sign up. And just for registering, one, you get the talks for free for those 7 days, but then you're also going to get How to Heal a Toxic Brain ebook that Dr. Jones and I wrote. You're going to get how to upgrade your brain to be more productive, maximize your memory and focus, and get into the flow state. So that comes with it, as well as some other gifts. I think you supplied a gift too, didn't you?
Sure did. Yep.
Yeah. So yes, that's how you can do that. Superhumanbrainmasterclass.com. But Dr. Osborne, I'm sure will share the link with you.
Yeah, we absolutely will. It's actually, we just put it up in the feed. So those of you just tuning in, if you want to sign up free for the Brain Masterclass, make sure you do that. It starts December 3rd. That's just next week. So make sure you go over there and just get signed up. Doesn't cost you anything, just your email. And we'll start, they'll make sure that you get registered. You'll start getting those classes when they're available. Mm-hmm. Well, Dr. Wolford, I don't want to take more of your time. I know you had a deadline, and I want to say thank you so much for being with us here tonight on Pick Dr. Wolford's Brain. And it's been my pleasure to have you here.
I can't thank you enough, Doc. Thanks.
Yeah, have a great evening, and we'll talk soon.
You got it.
All righty, take care. All right, so folks, we've got a few more of you chiming in with a few different questions and things. So I want to just do my best to get a couple of those other questions answered. We only had Dr. Wolford for a limited time tonight. So let's talk a little bit about some of the questions coming in. Marcia wants to know, does L-glutamine give any benefit to the brain? The answer is yes, it can, but really, where L-glutamine plays a role is in barrier function. It's one of its primary functions is it helps to keep the gut sealed. And I know you asked me about the brain, but just like Dr. Wolford just said, there's a leaky brain that comes as a result of leaky gut. So where L-glutamine's greatest impact really as a nutrient, as an amino acid nutrient, is on the tight junctions within the gut. And as long as those stay preserved, then we can preserve the tight junctions in the brain. Remember, it's a two-way, it's a step 1, step 2 kind of thing. So L-glutamine protects the brain by protecting the gut. Now, L-glutamine is also the fuel source for lymphocytes, which is our specialized type of white blood cell that help with autoimmune disease. So a lot of people don't realize that an L-glutamine deficiency can actually hinder their ability to fight an autoimmune condition. So in that regard, if we're talking about autoimmune brain conditions like Alzheimer's, which is now being recognized as partly autoimmune, then yes, L-glutamine can be helpful and can be beneficial. Although I would say make sure that you get tested. Don't just start pumping, massive doses of L-glutamine into yourself as just a thing to do, right? And that goes for any nutrient. Don't pump massive doses of any nutrient blindly. I would say it's definitely a better idea to get tested. Let's see. Sumera is asking, when you say get moving, does yoga count to get the spinal fluid moving? It absolutely does. Yoga counts. Yoga is one of the greatest forms of flexibility training that you can do. I love yoga. I actually incorporate it into my workouts on a regular basis. So yoga is really one of the best known formalized versions of whole body stretching. So I like to look at exercise in three ways. There's different components to exercise. So when I'm talking about getting to move, I look at one, which is just activity, like your daily activity, your walking and your movement. That's baseline. I don't consider that physical activity as much as I do consider that baseline movement. Then you have strength training, and strength training can be anything from body weight strength training to using things like kettlebells or plank holds, etc. But this is what keeps your muscles strong. So that we call this strength training because it either improves the strength of your muscles or it allows them to get stronger if they're atrophied or in an atrophied state. And then the third kind of element to exercise that you should be considering is your flexibility. And that's where yoga can be very, very helpful as that kind of third prong to the three kind of most important elements to any exercise program. You'll see it in the gym. A lot of the gym rats are really super big and muscly, but they can't touch their back or they can't bend their arm. That's an imbalance. Yes, they have lots of muscle, but they don't have lots of flexibility. And that imbalance can create other problems in joints. It can tighten joints, create joint dysfunction along the way, which can lead to later down the road pain and pain syndromes that can make it harder for a person to stay active. And again, the whole point is to stay active, not to exercise to the point where you create imbalance that creates pain that then inhibits your ability to be active. Let's see here. Other questions that are coming in. Sherry wants to know, can anesthesia cause forgetfulness if on the autism spectrum? Yeah, it can cause it if you're not on the autism spectrum. Anesthesia, for some people, depending on which anesthesia, which types, I mean, different people will react to it in different ways, but yeah, it certainly can cause forgetfulness. It should be short-term, meaning it shouldn't be a prolonged effect of the anesthesia, but I've seen cases where a person with liver problems and on multiple medications, getting an anesthesia and they don't process it out of their system very well, or they have a genetic mutation and they don't process it out of their system very well, it can really linger with a person, creating forgetfulness for some time. So yeah, to answer that question, anesthesia can definitely contribute to that. I like what Suzanne says. She says, I like to use nature to get fit, climb trees, carry logs and stones, hike mountains, fresh air and sunlight, moving as we're designed to move. Love that. That's really great. Great commentary on that regard, because so many people forget that being outside and being in nature allows for lots of great movement and fresh air. So absolutely. Let's see here. Dana wants to know what causes brain fog and chronic fatigue syndrome, and how much exercise should you do each day? With exercise, Dana, it's, there are lots of things that cause brain fog and chronic fatigue syndrome. So to answer your question, there's not one like smoking gun magic bullet. Gluten is a great place to start. And those of you who are new to the show and haven't already got your copy of No Grain, No Pain, pick it up. No Grain, No Pain, is kind of where I have people start when you're struggling with autoimmune issues or with chronic illness issues. But No Grain, No Pain, that you can pick that up at Barnes & Noble. You can pick it up at Amazon or any other major book retailer, is a great place to start the process of understanding how to best change your diet and how to eliminate some of the triggers for chronic degenerative diseases, including chronic fatigue. As far as how much exercise per day should you do, exercise is based on the person's ability to tolerate the exercise. So if you do, for example, 20 minutes of high intensity interval type exercise and it puts you in bed for 2 days, that's too much exercise. We've got to back that way down. My advice is, if you haven't exercised in a long time, you're not really sure what the answer is, start with small burst, small exercise first and work your way up. It's always better to kind of err on the side of caution than to just go full blown you probably have all heard the term weekend warrior. And that's what happens. You know, the term is oftentimes used in men when they played high school football or basketball or something and haven't played in 10 years. And then they go out on the weekend and they try to play as if they were 18 again, and they get injured or they take on some damage or hurt themselves. Look, that can happen. What you remember you could used to do is not necessarily what you can do, especially if you've been battling with chronic illness. So always take the exercise at your ability to tolerate it, and always err toward the side of doing less versus doing more. You can always increase as you go. Okay. Let's see here. Can swimming help lymphatic drainage? Any exercise can help lymphatic drainage. Remember that your lymph nodes and your lymphatic system is pumped, but it's pumped by movement. It's not pumped by your heart. So the way we help lymphatic drainage is movement, muscle movement. So any activity, including swimming, even though it's in a kind of a zero gravity emulation, right? It still helps pump your lymphatic system. So any movement is better than zero movement. And always, again, starting small, work your way bigger and bigger. Do I think that plyo would be good for flexibility and strength? Yes, absolutely. That question coming in from Patty. Susan, I get migraines from L-glutamine. Any idea why that can happen? Yeah, some people do. So like if you've taken L-glutamine and you've ever had migraines or headaches as a result, it's probably because you started at way too strong of a dose. First of all, this is going back to what I was saying earlier. Don't just go take glutamine to take glutamine. If you're going to take it, you know, you should know whether or not you need it. You have your doctor test you for glutamine deficiency. Taking too much glutamine too quick can trigger a migraine. It can also trigger diarrhea. So it's always best, you know, doses of L-glutamine generally can start, you know, in a pill, if you're buying an over-the-counter pill, from 500 milligrams to 800 milligrams. And some people, even at 500 milligrams, that'll give them a migraine. So they have to taper that dose up, starting out a lot lower, maybe start at 100 or 250 milligrams and just slowly work your dose up. And that oftentimes that won't happen for individuals. The only other time I recommend taking L-glutamine when there's no documented lab work that shows a deficiency is post-surgically. Post-surgically, glutamine is necessary to heal. So if you've had your muscles cut open or body parts cut open and you're trying to knit and heal that back together after the surgery, L-glutamine can be extremely effective, even if you haven't had tested or haven't been tested for an L-glutamine deficiency. Let's see. Christina says, diagnosed with SLE after, however, with nutritional changes, lifted off the meds and have controlled inflammation for 6 years. The weight is still an issue and I seem not to absorb D. Is there a correlation between vitamin D and brain fog issues or other issues with the brain? Absolutely. Vitamin D, very, very important. One of its primary jobs is to regulate how your immune cells behave. So think of it as the parent or parents to your immune cells. And if your parents aren't there, then, you know, the old saying, if the mice, or the cat's away, the mice will play. Well, if the parents are out of the house, the kids will throw a party, kind of a thing. And it's, you know, vitamin D is the parent to the immune system. So if it's not there to regulate proper function, either as getting rid of immune cells that are too strong and getting rid of immune cells that are too weak, then you can let into the circulation immune cells that aren't doing their job properly. And you can get a lot of abnormal biochemistry going on. And that can affect the brain as well, especially if there's an autoimmune problem that's attacking the brain and your vitamin D levels are low and not regulating that attack appropriately. So yes, there can be vitamin D issues associated with brain fog. Now, one of the other things that doesn't really get talked about very much anymore with vitamin D is that vitamin D is necessary to absorb calcium from your GI tract. So when you eat foods that contain calcium, your enterocytes or your small intestinal cells, they will absorb that calcium, but they need vitamin D to tell them to absorb that calcium. So if you don't have enough vitamin D, what ends up happening is you become calcium deficit. Now, calcium is an electrolyte that helps with neurological conductivity. So without enough calcium, the nerves can't communicate very well. If you've ever heard the term calcium channel or calcium gates, these are certain classes of medications, calcium channel blockers, that impede these to lower blood pressure, because calcium is used as a neurological stimulus. So if you don't have adequate calcium because your vitamin D is chronically low, that actually can create brain dysfunction, because your brain is one big segment or massive nerve tissue, right? So calcium, very important along that line. Okay, let's see here. Oh, thanks, Sandy. Sandy's from Wisconsin chiming in. Love No Gray, No Pain. So do I. I'm really fond of that work. Wink, wink. But thank you for your commentary. That's great. I'm glad you're getting your money's worth and your health's worth out of the book. Let's see here. Tracy, I am gluten-free and dairy-free, and a few years ago started having migraines, not sure what to eliminate food-wise at this point. Tracy, best thing that you can do is get with your functional medicine doc, have them run some more advanced food allergy testing. Food can commonly be a trigger, so can environmental chemicals. You might also make sure again, if your diet is pretty clean and dialed in, check for those other things. But sometimes too, yeast overgrowth can contribute to migraine, very, very common, as well perfumes and different things like odors that you might be being exposed to. I've had a number of people in my clinic, going through my clinic, that have major migraine headache triggers when they're sitting next to somebody, for example, in the airport, and they're wearing heavy loads of perfume or other chemicals. Soaps, detergents can be triggers. I actually did a really good piece on migraine triggers. Gosh, it's probably been 6 months now. If you go back to glutenfreesociety.org and you just type in headaches or headache triggers or migraine triggers, there's a chiming in. Yeah, Marie says, hard to work out with my sore medial collateral ligament. Yeah, roll it out. This is, if you don't have a foam roller, get a foam roller. I love foam rolling for like areas that are, harder to get blood flow into. Tendons and ligaments don't have as rich of a blood supply, let's say, as a muscle does. So sometimes foam rolling and stretching really well before your workout kind of loosens that up and reduces the soreness and get your body moving again. Remember, a lot of times, a lot of people have been so motionless for so long that they are sore, and there's going to be a period of breaking through some of that soreness that is necessary in order to achieve, adequate goals there. Let's see here, other questions. Do antibiotics, let's see, I'm not sure, I got to read this right. Question, does antibiotics are gluten-free? I think maybe Nancy, correct me if I'm wrong, but I think you're asking, are antibiotics gluten-free? And you recommend vitamin D. How much vitamin D do I recommend? I don't know. You can correct me if I'm wrong, but I had to kind of piece that one together. Antibiotics, you've got to check them. Like, your doctor could prescribe you antibiotics, and look, if you've got a roaring infection and it'll save your life, you need to take them. But you can always cross-reference the antibiotic on the ingredient list. I mean, when you're filling the prescription, there's two lists of ingredients on the drug. There's an active ingredient list and there's an inactive ingredient list. And if there's a gluten filler, it's going to be listed on the inactive ingredient list. And my advice would be, let me just pull this up for those of you who don't have. I'm going to pull up and post in the comment section here the master list of what foods and what things in what terms can mean gluten. So I'm going to put that into the feed right here for you. It's just going to be labeled as gluten list, and you can cross-reference your, again, your inactive drug list with any of the terms that you see on that list, and that might be helpful for you to, to better get an answer to that question, because any drug can contain gluten fillers. It's up to you to cross-reference the ingredients on it to determine it doesn't have them. I like this. Marie says, I used to have migraines, but since going gluten and grain-free, don't have migraines anymore. Such a common outcome for so many people struggling with migraines is just a diet change. Very, very simple to implement a diet change versus suffering with migraine headaches for decades. At least that's my opinion of the matter. Okay, looks like I think I cleaned up all the questions. If I missed yours, I apologize, but we're now at the point where we got to say goodnight. And what I'd like to say is happy belated Thanksgiving for those of you, again, who celebrate it. And we will see you back next Monday. Make sure, if you haven't already, pick up your copy of No Grain, No Pain. Especially if you're new to the show, and if you haven't started reading it, start applying it, especially chapter 7 and 8. There's actually even a chapter in there on movement and activity, which is what we talked about tonight. That's how important it is that I would dedicate an entire subject chapter on that subject. Additionally, make sure you visit us at Glutenfree Society, glutenfreesociety.org, and pick up a copy. It's free. It doesn't cost you anything. Just sign up for our newsletter, and we're going to send you your gluten-free survival kit. It's everything you want to know about going gluten-free the right way, not the wrong way, not the way that 99% of the rest of the world is telling you to do it, but the right way, the true gluten-free diet. So go over there. You can pick that up for free. And also make sure you're subscribing. If you're not already subscribed to our Facebook channel, where you can get this information on a regular basis, you can join us here, facebook.com, Dr. Peter Osborne. And you can join us there. You can also join us on our YouTube channel. That's youtube.com/glutenology. Please come by and visit us. Remember, our goal is to help 100 million people. If you didn't know that and you're just now hearing that, I take that goal very seriously. We do our best to reach the chronically sick, challenged populations of the world. There are 100 million chronically sick people. And do your part, right? I do my part every Monday night here by giving you and helping you with information that you wouldn't otherwise have access to. I just want you to know that you can share this information with anyone. I'm not offended if you share it. As a matter of fact, it's what I want, because together we can help more lives. We can help change the world. We can help save more people. We can help pull more people away from that hopelessness of medicating symptoms into obliteration until your health is destroyed. And we can get more people involved with our mission at helping 100 million people find real, true answers to their healthcare issues. So make sure that you're sharing this. Make sure that you're copying and pasting and sharing this with anybody who you know might benefit from it or who might need this type of help. As always, thank you so much for joining us. This is Dr. Osborne with the Pick Dr. Osborne Brain Show signing out. We will see you next Monday, same time, 6 p.m. Central Standard. Have a great week.